Good afternoon, everyone. I'm just going to go ahead and get started. My name is Cindy Chu. I'm a nurse practitioner, and I work at the Student Health Services, and my pronouns are she, her. Student Health Services is committed to promoting the physical health and wellness of all students at the Claremont Colleges. We're a team of physicians, nurse practitioners, registered nurses, medical assistants, medical receptionists, and administrators. And we're dedicated to serving the healthcare needs of all the students at this that are currently enrolled in the 7 colleges. Here, we're located at the Tranquata Student Services Building. We're kind of like across the street from where the library is. All medical information is confidential and cannot be disclosed without the student's consent. The only exception to this is if the student or the patient poses a danger to themselves or to others. We're open from 8 to 5, Monday through Friday, except for on Thursdays, we open at 9 a.m. and we're closed daily for lunch at 12 to 1. Students can call this health center to schedule an appointment. And we do ask that students bring their ID with them when they come to the Student Health Services. And there is a $15 missed appointment fee should they miss their appointment. Some of the services that we provide, we can provide acute and chronic care. So if your student has like a sore throat or a runny nose, things like that. Also any chronic issues like asthma care, high blood pressure, thyroid issues, etc. We also do complete physical exams for like pre-employment, study abroad physicals, and sports physicals. We provide injury and wound care. We provide sexual health care and sexually transmitted infection counseling, testing, and treatment. We also do provide HIV, PrEP, and PEP prophylaxis as needed. We have limited radiology at our health center, and also we do provide laboratory testing and dispensary, which has a small amount of mostly prescription antibiotics and contraceptives. And then we also do provide immunizations and tuberculosis screening at our center. Some of the COVID services we provide, we can do routine asymptomatic screening with saliva PCR testing. And there are going to be vending machines around campus so students can pick up the testing kits for PCR testing. If your student's having symptoms, they can also come in to have a rapid antigen test or PCR testing as recommended by their healthcare provider. Student Health Services also supports contact tracing and isolation and quarantine management on campus. And then we also do offer some of the COVID-19 vaccinations and boosters when they're available. Most of our visits have no fees if they're scheduled appointments. If there's a walk-in or non-scheduled visit, those have a $15 charge. And as I said, there's also a $15 charge for missed appointments. And then there's some information about the sports and study abroad physicals. If your student needs any medications from our dispensary, have any lab tests, injections or immunizations, x-rays, or other minor surgical procedures, there are nominal fees for those services. We will review with the student the cost of each service before they're performed. And we do not do any insurance billing. So any charges for any services received at Student Health would be billed to them or to their student account. Okay. If the students do not have to have the student health insurance plan to be seen at Student Health Services, if there are any charges, we can give the student a super bill, which has the correct coding so that you can submit to your insurance for reimbursement. However, that's dependent on what the type of insurance you have. That each student has access to a health portal, which you can access here. That's a QR code if they want to get to that site. That's where they'll get like their COVID test results. Also, you can exchange secure messages with the health center staff. You can get a copy of your billing in there. Also, you can review and update your immunization records. After hours, when we're closed for medical emergencies, students should call campus safety. There is urgent care centers. Pomona Valley Center Healthcare Center at Claremont is an urgent care center. Also, they can access emergency room services through either Pomona Valley Hospital or San Antonio Community Hospital. All students also have access to 24/7 telehealth services through 7C Health. And we do encourage students to try to get enrolled in 7C Health before they need it. But they can speak with like a healthcare provider, and if they need any medications or evaluation, then the healthcare provider can make those recommendations or call in prescriptions for them. They also do provide scheduled medical and counseling telehealth visits through the 7C Health also. So we do encourage students to be active in their healthcare. If they're not feeling better, they should always call us to come back to be seen again. And then that's just our website if they want to get more information. Does anyone have any questions? Yeah. No, it's the same price for any services because we do not do any insurance billing, even if they have the student health plan. Any other questions?
Give access to the medical records to the parents when they do that?
Yes.
So we submit it back through, do we have a time to need to be notarized?
It doesn't need to be notarized. You can access those forms through the student health website. And then usually it's only per academic year. So it's not like the student can sign it for all 4 years. So we do ask that the student sign it, and then they can upload it to the patient portal. And that way we have that copy there. Is there another question? Okay. Yes, usually it is, or we can point them in the right direction if it's not something like if it's more like a specialty care, we can point them in the right direction. No, unfortunately, the reimbursement depends on your insurance. I know Kaiser is pretty restrictive in what they will reimburse. A lot of PPO insurances will reimburse some, even though we're not considered in network with any insurance plan. But there are several Kaisers pretty close by to campus, also in Pomona. There's, I think, one in Claremont even.
Blue Cross, California, your experience with Anthem, as far as trying to do the reimbursement?
I don't know, because it's variable depending on what kind of plan you have, if it's like a PPO versus, you know, HMO and such. So that is more insurance based, not on us, but we will have all the appropriate billing and coding on there, so that hopefully that kind of expedites that for you. Yeah.
Sorry. You have your clinic price.
Right.
So the students have external insurance, out of state Blue Cross, and they come in. Does that include like doctor's fees, lab tests, X-rays, all that stuff in that one fee, or is that separate?
So like most appointments, if they have a called and have an appointment, most visits to have the consultation with the provider, there's no fee. Okay. There's only fees if they need like medications or an X-ray or lab tests and such, or immunization, then there will be a fee associated with that. And then we don't do any insurance billing at all. So what would happen is that fee would be billed to the student, and then they can submit the copy of the receipt to the insurance for reimbursement.
You have the urgent for public drop-in as well as appointments, or?
We are appointment based. We do have some same day appointments each day. So if the student is not feeling well, we always encourage students to call first thing in the morning so we can slot them in for those same day appointments. No, we have a small dispensary, but our dispensary is pretty limited to mostly just contraceptives, immunizations, and a few antibiotics. So if they're on chronic medication, usually they'll transfer to a local pharmacy. And if transportation is an issue, Hendricks Pharmacy is the closest pharmacy to us in the village, and they do delivery to campus. So that's something that the student can arrange through that. We have both physicians and nurse practitioners. Any other questions? They can access the super bill through the patient portal, so they can get it themselves offline. Any other questions? If you go to our website, which is right there, and then go to scroll down to where it says forms, and then you can get the I think it's called medical record release form, and you can have your students fill that out. Any other? Okay. Sometimes it depends on where and when the situation occurs, but a lot of times if the student has an injury, they come into student health services, they'll have an evaluation by one of the healthcare providers, whether it's a physician or a nurse practitioner. And then if a determination is made that they need to go to the emergency room, then we can do a referral at that point. If it's something like really serious that happens, somewhere elsewhere on campus and they're unable to come in, sometimes campus safety will directly call emergency services to transport them by ambulance. We're in the Tronquata Student Services Building. It's kind of across the street from the main library. I don't know how else to describe it. It's on College Way, but we're housed with Monster Counseling Center and the Health Education Office and Student Disability Resource Center. Did you have a question over here? So if they're over 18, they're considered an adult. So in terms of like the student can have a record release signed saying that they want us to release information to their parent. Usually if it's something more serious, we always do ask the student if they would like us to contact their parent. But at that point, it would be up to the student. However, I believe that, sometimes if there's something more serious, we will notify the dean of students. And then they have different restrictions than what we have in terms of what can be communicated with parents. It would be offered to them either way, or, we have sometimes students that it might not be something more serious, but they still want us to discuss it with their parents. They can let us know. We can do that also. But if that is concerned, just have your students sign that release form ahead of time. Sometimes it just expedites and makes it a little bit easier. Yes, you can get it on our website and it's under forms, like the little section that says forms. Yeah, from past years, even if they're under 18, because they are living independently here at college, they're considered an emancipated adult, so they can still consent for their own healthcare services. Yes. Yes, I believe so, because she would still be considered an emancipated adult, according to California. Are there any other questions?
One more, just on the standpoint. So, if it's not a life-threatening ER situation, but it does still require getting to central the hospital. Is there, it doesn't have a positive process. Is there,
So that's always been a little bit more tricky. A lot of times it's we can contact the dean of students at each college, and sometimes the dean of students can help facilitate a transport. Other times that student will find a friend that does have a car that can transport them. And then we do have some limited like Uber vouchers that we can give to students if it's not anything like emergent, but that they need. Yeah. Any other questions? Okay, thank you and welcome to the Claremont Colleges.